For many parents, getting a child to go to bed can be a real nightmare, so much so that it's become a national problem. A recent poll by the National Sleep Foundation shows that America's children are sleeping less than experts recommend, while more than 2/3 experience frequent sleep problems. Those findings are proving to be a wake-up call for parents. As pediatrician Janet Dellinger explains, those problems at bedtime can mean a lot more than just having a sleepy head on your hands.
If children don't get enough sleep the next day, they're very cranky. There have been studies that have shown that they don't perform well in school if they have bad sleep habits.
In fact, doctors mistakenly diagnose some children with attention deficit hyperactivity disorder, when all they really need is more or better sleep. So how much sleep does your child need? The recommended amount for infants is 14 to 15 hours of sleep during a 24-hour period. For toddlers, 12 to 14 hours. Preschoolers should be averaging 11 to 13 hours. School-age kids, around 10 to 11 hours. And teens should be getting around 8.5 to 9.5 hours of sleep. Dr. Dellinger has this advice for parents. Consider it the ABCs on helping your child catch their Z's.
The biggest thing parents can do for a toddler is to establish a routine. They need to know that the parent is in charge. They need to know that bedtime is going to occur in the same sequence every night. We try to avoid the wrestling and the tumbling and the fun activities that a lot of parents like to do that in the evening, but that needs to be done right after dinner, not right before bedtime, because that gets them all excited. The biggest thing we see, which is preventable, is exposing the children to audio and visual stimulation in the evening time that have graphics that are going to stick in their mind. They may incorporate that into their dreams.
For a child having difficulty sleeping, crawling into bed with a parent seems like the ideal solution, but it will more likely prolong the problem.
Most of the time when the parent has allowed the child into the bed, we know that that started out with a very good motivation. But what they don't realize is down the road, it may actually hurt the family rather than help. And you want the child to have a feeling of his own space, of his own, own bed.
And teenagers have unique sleep needs. Since their internal clocks are delayed, they may not be alert until well into the school day. Adjusting their sleep schedule by 15-minute increments is a start. Parents can even help by monitoring late-night computer, television, and telephone usage, and explaining to a teen how sleep affects their grades, their emotions, and their relationships with others. By following these helpful hints, getting your child to go to bed can be a dream come true. For Smart Medicine, I'm Lorraine Cachola.